Welcome to the SVG-TV news for Monday, January 10th. I am Khalil Kato with the details. Governor General, Her Excellency Dame Susan Duggan, is optimistic that St. Vincent and the Grenadines will bounce back from the numerous challenges faced in the past year, including the pandemic and the eruption of the La Soufrière volcano. Delivering her throne speech at the second session of the 11th Parliament today, Her Excellency outlined the many developments to take place in 2022 by the government to the benefit of Vincentians.
Government's unflagging commitment to the vulnerable will be reflected in legislation that is meant to give greater protection to persons with disabilities and the elderly. During the past year, legislation such as the Public Service Management Act, intended to bring about improvements to governance structures within the public service, was also passed in this Honorable House. It is expected that these provisions will be fully implemented during this financial year. Additionally, service delivery within the public sector in these changed circumstances will be modernized through the implementation of a digital transformation project which aims to improve access via secure online platforms.
The Governor General said infrastructural development and employment opportunities will also be of benefit to many.
Housing is projected to assist in stimulating the construction industry during the 2022 to 2023 fiscal period. This impact will be augmented by the following: hotel construction, the Modern Port Development Project, the Acute Referral Hospital Project, the Temporary Parliament Building Project, followed by the Modern Parliament Building Project, the new High Court Complex, and the rehabilitation and repair of public infrastructure, which will include the repair and rebuilding of several schools, extensive roadworks, and coastal defense projects, among others. The design phase of the modern city at Annisville will also be advanced in the upcoming period. Madam Speaker, the opportunities for employment of our nationals at the planning, execution, and operational phases of these projects are great.
Her Excellency also used the opportunity to thank frontline workers for their services rendered over the last year as the country continues to deal with the fallout of the pandemic and the eruption of La Soufrière.
I also want to commend the healthcare workers of this country for the commitment, courage, and fortitude that they have demonstrated throughout this protracted global health emergency, for which no end is yet in sight. I thank you for your service to the people of St. Vincent and the Grenadines. For 2022, the Ministry of Health, Wellness and the Environment will persevere in discharging its duties to citizens and visitors. The COVID-19 response will continue to demand the attention of policymakers, medical practitioners, and the support staff and the managers and administrators in the area of healthcare.
Meanwhile, as he commenced the presentation of the 2022 budget, Minister of Finance Camilo Gonzalez told Parliament that in an unprecedented year of disaster, dislocation and disease, St. Vincent and the Grenadines has been tested like never before in our modern history. He noted that after enduring a hurricane, a pandemic and a volcanic eruption, Vincentians have been battered but unbowed, and that the unconquerable soul of the nation remains undefeated. The finance minister said his government remains steadfast in its pursuit of policies, programs and projects that will enable Vincentians to thrive in a rapidly changing world, and that Budget 2022 has 4 immediate goals, which include tackling the pandemic head-on.
To keep Vincentians safe from COVID-19 while effectively addressing the consequences of the pandemic, to respond to the multifaceted social and infrastructural toll of La Soufrière's eruptions, to pursue fresh initiatives in accelerating our economic recovery, and to transform our country further by creatively tackling foundational challenges, in particular climate vulnerability, inequality, and infrastructural deficits. Yet, more fundamentally, Budget 2022 casts our present moment as an opportunity, not for mere recovery, but rebirth. The last 21 months have been marked by tremendous disruptions. But while their effects linger, those disruptions have already taken place. We are weathering them. The question now is whether we strive to return to a pre-disruption state or whether we reform and reimagine what has been disrupted.
Minister Gonzalez said Budget 22 also presents an opportunity for a rebirth to advance a more people-centered, island-specific alternative to the indifferent developmental narratives forced on us from afar.
When faced with past challenges, St. Vincent and the Grenadines, like other countries, has often focused on regaining precisely what was lost, instead of reimagining what could be. This time, we will not look back in perpetual pursuit of a past status quo. As our local wisdom often admonishes, back a debt. Budget 2022 instead looks forward, with history as a guide, but not a destination. We are pragmatic about our many constraints, but positive about our boundless possibilities. Yesterday's paradigms, especially those warmed over from an uninformed distance, will not solve tomorrow's problems. The language of the past is not fully suited to address the challenges of the present. Even amidst continuing hardship and uncertainty, Budget 2022 views the coming year through the prism of optimism and opportunity.
The Finance Minister said Budget 2022 will advance fresh initiatives, target digital transformation of businesses and governance, invest heavily in the blue economy, and reimagine education in the face of unprecedented and unpredictable challenges.
Budget 2022 also charts a course for a reinvigorated tourism sector and focuses on the development of climate-resilient infrastructure as an engine for accelerated economic recovery. It implements a series of community-level projects to spur local wealth creation and engender social solidarity. And it redoubles efforts to facilitate job creation and youth development to capitalize on emerging opportunities. At the same time, even as we look ahead, Budget 2022 steadfastly addresses ongoing fallout from the monumental twin challenges of COVID and the volcanic eruptions. We will extend the most significant expansion of social safeguards in this country's history to protect vulnerable and displaced Vincentians. We will strengthen our drive to inoculate people against the worst effects of COVID and fortify our health sector to treat victims of the pandemic. Further, we will engage in the most comprehensive post-volcano program of reconstruction, relocation, and rehabilitation ever undertaken in St. Vincent and the Grenadines.
Noting that Budget 2022 is being presented in one of the most challenging 12-month periods in our modern history, from local disasters to international crisis, Minister Gonzalez said the economy withstood the extraordinary pressures, and this will shape the budgetary responses and planning for years to come. Two government ministers, namely Minister of Agriculture Soboto Caesar and Minister of Education Curtis King, have tested positive for COVID-19. Given the time period for isolation, the two government ministers are expected to miss the 2022 budget debate, which will commence tomorrow and wrap up on Friday. On radio today, Prime Minister Dr. Ralph Gonzalez said he is expected to seek guidance from the Speaker of the House to see if the two MPs can vote on the 2022 appropriation bill via telephone.
Just to the Speaker of the House, because you don't know whether we are going to have everybody going to be there, or at least a quorum at the time when you're voting, that people can phone in their vote now on the appropriation bill, the members of the House. You know, for instance, Sabi must be able to vote even though he can't come to the House. So to Curtis or anybody else for that matter. who contracts COVID now. You know, the business of the government has to continue. I mean, if I had been tested positive for COVID, it means I couldn't go to the house, but that doesn't mean that I can't call in my vote, because you have to pass the appropriation bill to get on with the business of government.
Right.
And I'm hoping that the Speaker considers that favorably, and for us to get on with the business. And those who are in the House would speak. I'm talking on the government side. Those who can come to the Parliament, and I would make sure that, because of all the circumstances, that I would get in accordance with the rules.
Noting that the two MPs are fully vaccinated, PM Gonzalez said it is important that fully vaccinated persons take the booster shot when it is due.
That the time given by the health authorities for the boosters, given what is the changing scene of the virus, for instance, the Omicron and the variants, what you are able to withstand with the vaccine up to 6 months, or 7 months, or 8 months, maybe slightly less, and you need a booster. I don't know precisely, but that is obviously something which we'd have to look at. But the danger always with that is that they give you the time to come back for the booster on the state of the science as it then is, in relation to the transmissibility of a particular variant. Fortunately, when you're vaccinated, even though it tapers off the effectiveness, you still have protection. So that even if you get it, you wouldn't get it so seriously now.
According to reports, the COVID-19 status of the ministers was diagnosed during testing for all MPs ordered by the Chief Medical Officer, Dr. Simone Kieser-Beach, ahead of today's budget presentation. With the recent surge in COVID cases, calls have been made for mass testing. PM Gonzalez says it is not logical and impossible, and explained the unlikely factors involved.
It is what you do there for, in particular, employment units. If there are persons who contract the COVID, you can do testing at a particular point in time, but you can't go about the countryside testing everybody. It's just impossible. It is physically, and in terms of the materials and the cost.
Yes.
It is that doesn't happen anywhere. You can't test everybody. So those who are arguing for that are arguing for something where they're trying to avoid telling people that you have to take the vaccine. Or if you tell people that for certain frontline positions, when you require it, they then oppose it. That is not logical, because you have always to be managing risks.
And the Ministry of Health, Wellness and the Environment has given the approval for the home rapid antigen tests for the diagnosis of COVID-19 for the period January 3rd to January 17th. According to the ministry, the following recommendations should advise the use of the home rapid antigen tests. 1. A positive rapid antigen home test will be registered as positive by healthcare providers and reported to the national epidemiologist. No further testing would be required. Clearance from isolation must follow the recommended period of 5 days for vaccinated persons without symptoms and 14 days for unvaccinated persons. 2. Persons who test positive are asked to call their nearest flu clinic or private healthcare provider to log their information, which will facilitate the required sick leave and NIS documents needed. 3. If symptoms worsen in a person who tested positive with an antigen test, the person is advised to contact the nearest flu clinic or private physician for an assessment, as persons can deteriorate rapidly if left unmanaged. The ministry, however, noted that the home rapid antigen tests should be WHO, FDA, EU listed and in use in the country of manufacture, and that it will monitor the situation and provide further guidance and updates where necessary. With a third surge in new COVID-19 cases in SVG, infectious disease specialist Dr. Gerald Thompson said persons must be more diligent, stringent, and careful in this period. Speaking on WeFM's Issues at Hand program on Sunday, the infectious disease specialist said that it is possible that the Omicron and Delta variants are the two main COVID-19 variants being spread across the country. Dr. Thompson said that some of the previous protocols may have to be revisited, and persons must understand the value of wearing a mask.
For here in St. Vincent and the Grenadines, we too have to be on our guard. If in Trinidad you could see these massive jumps in cases around the world, the amount of cases doubling within the space of a month, then we have to also be very mindful of this. And we have to go back to certain protocols. First of all, no doubt, we have to ensure that everybody understands the value of a mask. We have, and I was one of those who was promoting the use of the cloth mask. They are good, decent masks. However, if you have something like a bandana tied around your face, that's a single layer protection. It's not good enough. You must have something that's double layer. And this is a cloth mask that allows for a surgical mask to be placed on the inside to give you that double protection.
Making a distinction between the two COVID-19 variants, Omicron and Delta, Dr. Thompson outlined why it is important that persons get fully vaccinated or get a booster shot, which he said will ensure their antibody level remains high.
I said the Delta loves lungs, the Omicron likes the upper airways. The Delta incubation period also is about 4 days, when the earlier variants in 2020 was 6 to 7 days. So 4 days before symptoms. But with the Omicron, it's a matter of just 3 days. So you're seeing symptoms even earlier on. We saying with the Delta, the vaccine are still modestly protective against all 4 aspects of what we call the effectiveness. And this is important to distinguish. When the initial studies were done, they may have come up with an overall effectiveness, such as the AstraZeneca is 90%, let's say, or the Moderna is 94.5, or Pfizer 95, and Sputnik 92.
Meanwhile, the Ministry of Health is again reminding persons not to take any flu-like symptoms lightly during this period, as it could turn out to be the COVID-19 virus. Health Promotions Officer Shanika John said that this time around there are procedures for testing and isolation for the vaccinated and unvaccinated, which should be followed.
And now is between whether or not you're vaccinated or you are unvaccinated. So that is something that you have to know. So if you are in a vaccinated household, fully vaccinated, everybody there is covered, and you are a known contact because your mother, your father, your uncle, whoever is tested positive, you are allowed to continue for 5 days with your N95 mask, double mask, and then you test on day 5. However, if you're unvaccinated, you're asked to quarantine from other persons within your household, and then you go. So if by day 5 you still have no symptoms, you can then call your flu clinic and they would better advise you. If you are symptomatic, then we treat you as a known positive.
Also, the Ministry of Health is putting systems in place to ensure people access healthcare during the spike in COVID-19 cases. This includes the opening up of the Victoria Park as a flu clinic.
That the Kingston Flu Clinic is going to be moved to Victoria Park. And so regular clinic will be assumed at the Kingston Health Center. So for those persons who are in the Kingston district and you're going to be seeking care for those persons who have flu-like symptoms, etc., your new location would be at the Victoria Park. And for those persons who are seeking care outside of COVID, you can now resume your services at the Kingston Health Center. And so all of this is part of our rollout to have that continuity of care for persons. Because while we're still dealing with the pandemic and dealing with all the challenges and all the detection and the containment measures, we still have to ensure that those persons who need the care that they need still can have access to those services.
The opening of the new law year 2022 for the Eastern Caribbean Supreme Court will take place virtually tomorrow for the second consecutive year. Chief Registrar of the Eastern Caribbean Supreme Court, Michelle John Tibbles, told SVG-TV News via an interview on Zoom that other than the Chief Magistrate's featured address, there will be 9 speakers from the member states, including St. Vincent and the Grenadines' representative, Rene Batiste, who currently serves as president of the SVG Bar Association. The Chief Registrar is encouraging persons across the OECS to be more informed on the justice system and listen to her ladyship Gretel Thom's address tomorrow at 10 a.m.
The ceremonial sitting promises to be invigorating as well as enlightening. So we just want to urge persons to plan for it. Set this time apart to be a part of the court, to hear what the court has to offer, rather, how the justice system is planning to work for you, how the justice system has worked for you over the last calendar year, and the plans to continue working for 2022. It's our court. Therefore, it's our business to get involved and to know what's going on with our court. You can expect to really hear answers to a lot of the questions, the burning questions. Some things persons may not have known about the court. This will be shared.
The theme for the opening of the new law term is the ECSC reimagining the justice system in the era of COVID-19 and beyond. According to the Chief Registrar, the theme demonstrates the changing times in a pandemic.
We too have had to shift gears and move into a sort of virtual environment to ensure that we continue to provide the level of justice that is required of us for the people of the OECS. And so the court has had to reimagine ways in which we can do that. Not just the court, but other stakeholders. If you speak to lawyers, you would hear too that how they have had to reimagine their practices of law, how they go about ensuring that the service that they have to provide to persons still remains or rather I should say that they can minimize the effect that COVID-19 would have on those services provided.
The St. Joseph's Convent, Kingstown, is hosting a year-long celebration of its 75th anniversary. Opening its doors on Monday, January 2nd, 1947 as a private school for both boys and girls, the school was established for the purpose of instructing children in the Catholic faith and in secular subjects. Located in one of the rooms of the sisters' residence, The Palms, the St. Joseph's Preparatory, as it was called at the time, had an enrollment of 4 students: Patricia De Santos, Paul McLeish, Reginald De Silva, and Orrin Cotter, with Mother Ina as the first principal. By the end of the year, the number increased to 19. Today, the St. Joseph's Convent, Kingstown has become one of this country's top educational institutions, instilling in the lives of young girls Christian values and principles through the provision of holistic education. To celebrate its Diamond Jubilee, the St. Joseph's Convent, in collaboration with its Past Students Association, has planned a number of special activities and programs throughout the year under the theme Building Stronger Gems, Past, Present, and Future. A news release said the events will highlight the history of the school and celebrate its many accomplishments. Bishop of the Roman Catholic Diocese of Kingstown, Bishop Gerard County, will be the main celebrant at the Mass to mark the start of the activities at the St. Mary's Catholic Church in Kingstown on Saturday, January 15th, commencing at 2 p.m. An anniversary choir of past and present St. Joseph's Convent Kingstown students will be featured. The other celebration activities will include lectures, fundraising events, mentorship sessions, and more.